If you have recently noticed mild chest discomfort, irregular or rapid heartbeat, unusual fatigue after short walking distances, or occasional shortness of breath at night, you may be experiencing age-related cardiovascular problems. In older adults, heart disease rarely presents with dramatic symptoms. Instead, it progresses quietly through small but persistent changes. In today's session, I, Dr. William Carter, will guide you through the early warning signs, the moments when a medical evaluation is necessary, and the long-term habits that can help protect your heart. Please subscribe, leave a comment saying, "I am experiencing," and share this content with your loved ones so they can benefit as well. In older adults, the early symptoms of heart disease are often subtle and easily mistaken for normal aging. Many seniors feel short of breath after a short walk, need to pause while climbing a few steps, or notice a stronger than usual heartbeat even without exertion. These early signs indicate that the heart is working harder than it should and deserves attention. These small but persistent changes are the body's first important warning signals. One of the most commonly overlooked symptoms is a brief feeling of chest heaviness. Heart disease does not always produce severe pain. Sometimes it appears as a mild pressure, as if something is pressing on the chest for a few seconds before fading. This symptom is concerning because it may signal early coronary artery blockage or reduced blood flow to the heart. Even if the discomfort is mild, repeated episodes should never be ignored. Difficulty breathing while lying down is another key indicator. Many seniors report that when they lie down to sleep, they suddenly feel short of breath and must sit up or add extra pillows to breathe comfortably. This is a classic early sign of heart failure, when fluid begins to accumulate in the lungs. Even if the symptom doesn't occur every night, a few episodes are enough reason to seek medical evaluation. In the early stages, the most important step is to listen to your body. Seniors should reduce salt intake, stay hydrated without overdrinking, rest when the heart feels strained, and monitor body weight each morning to detect fluid retention. Over the long term, regular cardiac checkups, proper blood pressure control, and light physical activities like walking can help keep the heart stronger. No symptom is ever too small when it concerns the aging heart. As we age, the structure of the heart and blood vessels undergoes natural changes. The arterial walls become stiffer, the vessels lose their elasticity, and the heart must work harder to pump blood throughout the body. This is why many older adults develop high blood pressure, irregular heart rhythms, or persistent fatigue. These gradual changes occur silently over years, allowing heart disease to develop even in those who previously seemed perfectly healthy. Another common cause is the buildup of plaque inside the arteries. Over many years, cholesterol, fats, and cellular debris accumulate along the arterial walls, narrowing the passageway. When blood flow to the heart decreases, older adults begin to experience chest pain, shortness of breath, and dizziness. Coronary artery plaque is the leading cause of heart attacks and stable angina in seniors. Irregular heart rhythms are also common among older adults. As the heart's electrical conduction cells weaken, the rhythm may become too fast, too slow, or irregular. This condition, especially atrial fibrillation, increases the risk of blood clots and stroke. Many seniors notice only brief palpitations, but these mild sensations can be early signs of significant arrhythmias. Beyond natural aging, several additional factors accelerate the development of heart disease, including long-standing hypertension, diabetes, obesity, high-salt diets, physical inactivity, and chronic stress. Although these factors may seem familiar, their cumulative effects greatly weaken the heart over time. The best way to protect your heart is to manage each risk factor consistently, beginning with small daily lifestyle adjustments. Not all chest pains are the same, especially in older adults. Some pains appear briefly when changing posture, but heart-related chest pain usually feels like tightness or pressure, as if something heavy is weighing on the chest, sometimes radiating to the shoulder, neck, or left arm. Many seniors describe it as a deep internal discomfort rather than a surface pain. This is a classic sign of reduced blood flow to the heart and should be taken seriously. If chest pain is suspected to be heart-related, the first step is to stop all activity, sit down, breathe steadily, and call emergency services if the pain lasts more than a few minutes. Seniors should not drive themselves to the hospital because of the risk of fainting or sudden arrhythmias. Long-term management includes controlling cholesterol, managing blood pressure, taking prescribed medications regularly, and maintaining light daily exercise to prevent recurrence. If chest pain is suspected to be heart-related, the first step is to stop all activity, sit down, breathe steadily, and call emergency services if the pain lasts more than a few minutes. Seniors should not drive themselves to the hospital because of the risk of fainting or sudden arrhythmias. Long-term management includes controlling cholesterol, managing blood pressure, taking prescribed medications regularly, and maintaining light daily exercise to prevent recurrence. Rising blood pressure with age is common because the arteries gradually stiffen and lose their elasticity. As a result, with every heartbeat, it becomes more difficult for blood to flow through the vessels, causing blood pressure to increase. Many seniors do not feel any symptoms, yet this silent rise in blood pressure places significant strain on the heart, kidneys, and brain, setting the stage for serious complications later. One of the greatest dangers of high blood pressure is that it often produces no symptoms in its early stages. Older adults may feel perfectly fine for years until headaches, dizziness, blurred vision, or even a stroke suddenly occur. This silence is why hypertension is known as the silent killer, especially in adults over 65. High blood pressure not only forces the heart to work harder, but also causes long-term damage to vital organs. When blood pressure remains elevated over time, the vessel walls may thicken, narrow, or even rupture. This greatly increases the risk of heart failure, kidney failure, and stroke. For seniors, even a slight rise in blood pressure can accelerate health decline much faster than in middle-aged adults. To manage blood pressure effectively, older adults should monitor their readings daily, reduce salt intake, limit processed foods, and maintain consistent light exercise. It is also crucial to take medications exactly as prescribed and not discontinue them when readings appear normal, as this can lead to dangerous fluctuations. Blood pressure control is a long-term commitment that requires consistency and careful monitoring. Shortness of breath is one of the most common signs of heart problems in older adults. When the heart cannot pump enough oxygen-rich blood to the body, the lungs compensate by increasing breathing rate. Many seniors find themselves needing to pause after just a few steps or after changing positions. Even mild but persistent breathlessness is a sign that the heart may be struggling. especially if it occurs at rest. One major cause of breathlessness is heart failure, which occurs when the heart can no longer pump blood effectively. As a result, fluid may begin to accumulate in the lungs, creating a feeling of chest heaviness and difficulty taking a deep breath. Many seniors describe it as not getting enough air. This symptom is often most noticeable when lying down, forcing the person to sit upright or use extra pillows for relief. Breathlessness may also be caused by irregular heart rhythms, where the heartbeat becomes too fast or uneven. When this happens, the heart cannot pump blood efficiently, leading to dizziness, palpitations, and rapid breathing. Atrial fibrillation, which is common in seniors, reduces the amount of blood pumped with each beat, making individuals feel short of breath even while resting. To relieve shortness of breath immediately, seniors should sit upright, relax their shoulders, inhale slowly, and exhale longer. If breathlessness is accompanied by chest pain, cold sweats, or lasts several minutes, it is an emergency, and medical help should be called immediately. Long-term improvement comes from managing blood pressure, treating arrhythmias, reducing salt intake, and maintaining gentle daily activities like walking to strengthen heart function. Swelling in the legs and ankles is one of the most noticeable signs that the heart is beginning to weaken. When the heart can no longer pump blood efficiently, blood and fluid accumulate in the lower parts of the body, especially the legs. Many seniors find their shoes tight at the end of the day or notice ankle swelling that leaves an indentation when pressed. This is not simply a sign of aging, but a clear indication that the body is retaining fluid due to reduced heart function. Swelling doesn't occur only in the legs. It can also appear in the abdomen or around the eyes as heart failure progresses. When fluid accumulates, older adults may feel bloated, heavy, or notice rapid weight gain within just a few days. These subtle changes indicate that the heart is struggling with excessive pressure and can no longer manage the body's fluid balance effectively. A simple way to identify heart-related swelling is to observe when it appears. If the swelling worsens toward the end of the day and decreases after rest or leg elevation, it is likely caused by the heart. Heart-related swelling is often accompanied by shortness of breath, fatigue during light activity, or chest heaviness. These associated symptoms help distinguish it from swelling caused by arthritis or kidney disease. For immediate relief, seniors should reduce salt intake, elevate their legs when resting, and monitor daily weight to detect abnormal fluid retention. If swelling is accompanied by shortness of breath, chest discomfort, or rapid progression, medical evaluation is urgently needed. Long-term management includes maintaining stable blood pressure, using diuretics as prescribed, and engaging in light exercise to significantly reduce swelling. One of the most common arrhythmias in older adults is atrial fibrillation. In this condition, the atria beat irregularly, allowing blood to pool and form clots. If a clot travels to the brain, the risk of stroke increases dramatically. What makes this especially concerning is that many people do not experience noticeable symptoms. Some may feel only mild palpitations, fatigue, or slight shortness of breath, yet they may be living with a significant danger. Arrhythmia is a condition in which the heart beats too fast, too slow, or irregularly. In older adults, it is particularly common because the heart's electrical conduction system weakens with age. Many seniors notice skipped beats, sudden strong beats, or brief episodes where the heart feels like it is fluttering. These subtle changes may occur at rest, after meals, or during mild anxiety. Yet they are important signs that the heart is struggling to maintain a stable rhythm. To manage arrhythmias effectively, regular monitoring and strict adherence to medical guidance are essential. Many patients require medications to control heart rhythm or prevent blood clots. Seniors should avoid excessive caffeine, reduce stress, and maintain healthy sleep habits to lower the risk of recurrence. Long-term protection comes from routine cardiac evaluations and paying attention to even the slightest changes in heart rhythm. Many older adults experience chest discomfort or heaviness during physical activity such as brisk walking, carrying groceries, or climbing stairs. This is a classic form of exertional angina caused by insufficient blood flow to the heart when it works harder. At this stage, the coronary arteries are often significantly narrowed, forcing the heart to strain to meet the body's demands. The discomfort usually disappears with rest, but it should never be ignored. Exertional angina typically lasts for a few minutes and subsides with rest. However, in older adults, the symptoms are often mistaken for indigestion, fatigue, or muscle strain. Some may feel only mild pressure in the neck, shoulder, or jaw, yet these are classic signs of reduced blood flow to the heart. Such atypical presentations lead to many cases being overlooked for years. The primary cause of exertional angina is narrowing of the coronary arteries due to plaque buildup. When oxygen demand increases, the heart cannot receive enough blood, resulting in pain. If this condition persists, the risk of heart attack rises significantly. Some seniors may also develop arrhythmias during exertion, worsening the symptoms. This is a warning sign that the heart is operating near its limit. When chest pain occurs, older adults should stop activity immediately, sit down, and breathe slowly. If the pain does not subside after a few minutes or becomes more intense, emergency medical help is necessary, as it could indicate a heart attack. Long-term management includes controlling cholesterol, losing excess weight, maintaining gentle regular exercise, and following prescribed medication plans. Even mild chest pain should never be dismissed or pushed through. Stroke is one of the most dangerous complications of heart disease in older adults. When the heart rhythm becomes irregular, especially in atrial fibrillation, blood clots can easily form and travel to the brain, blocking blood flow. Many seniors are unaware that up to 30% of strokes in older adults originate from heart problems. Symptoms often appear suddenly, such as facial drooping, weakness on one side of the body, or difficulty speaking. Every minute matters for recovery. Some stroke symptoms are subtle, including dizziness, loss of balance, double vision, or mild facial numbness. Because these signs occur quickly and without pain, many people assume they are caused by fatigue or low blood pressure. However, when the brain is deprived of blood flow, nerve cells begin to die within minutes. Recognizing these symptoms early dramatically improves the chances of recovery and reduces long-term disability. The underlying causes of heart-related stroke are usually high blood pressure, atrial fibrillation, and atherosclerosis. High blood pressure weakens brain vessels, making them prone to rupture, while atrial fibrillation promotes clot formation. Atherosclerosis narrows the blood flow to the brain. Together, these conditions dramatically increase the risk of stroke in adults over 65. Managing cardiovascular health is therefore the most effective way to prevent stroke. When a stroke is suspected, the most important action is to call emergency services immediately rather than waiting for symptoms to improve. Do not drive the patient yourself, and avoid letting them lie flat for too long. While waiting for help, keep the person in a slightly side-lying position to prevent choking if vomiting occurs. Long-term prevention includes taking prescribed medications, managing blood pressure, treating atrial fibrillation, and maintaining a healthy lifestyle. Long-term heart care in older adults is not about dramatic changes overnight, but about building small, sustainable habits over time. One of the most essential steps is maintaining a low-salt diet with plenty of vegetables, fish, and whole grains while limiting fried and processed foods. These dietary choices help control blood pressure, lower cholesterol, and reduce the risk of plaque buildup. Even small adjustments can have significant benefits when practiced consistently. Daily, gentle exercise is essential. Older adults should engage in activities such as walking, breathing exercises, light yoga, or slow cycling. These activities help improve circulation, reduce strain on the heart, and enhance overall flexibility. The key is not to overexert. Even 20 to 30 minutes a day can make a meaningful difference in heart health. Regular medical checkups are vital for early detection of hidden problems. Older adults should monitor blood pressure, blood sugar, cholesterol levels, and undergo routine electrocardiograms as recommended. These evaluations help adjust medications in time and assess long-term cardiovascular risk. Many serious complications can be prevented through early detection and proper treatment. Emotional well-being plays a crucial role in heart health. Chronic stress increases heart rate, raises blood pressure, and accelerates heart disease progression. Seniors should engage in relaxing activities such as reading, listening to music, talking with loved ones, or joining community groups. A healthy heart requires proper nutrition and exercise, but also peace of mind.